Risk factors. Risk factors for diabetes depend on the type of diabetes. Family history may play a part in all types. Environmental factors and geography can add to the risk of type 1 diabetes. Sometimes family members of people with type 1 diabetes are tested for the presence of diabetes immune system cells autoantibodies. If you have these autoantibodies, you have an increased risk of developing type 1 diabetes, but not everyone who has these autoantibodies develops diabetes. Race or ethnicity also may raise your risk of developing type 2 diabetes, although it's unclear why certain people, including Black, Hispanic, American, Indian, and Asian American people, are at higher risk. Prediabetes, type 2 diabetes, and gestational diabetes are more common in people who are overweight or obese. Complications. Long-term complications of diabetes develop gradually. The longer you have diabetes and the less control your blood sugar, the higher the risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. In fact, prediabetes can lead to type 2 diabetes. Possible complications include heart and blood vessel cardiovascular disease. Diabetes majorly increases the risk of many heart problems. These can include coronary artery disease with chest pain, angina, heart attack, stroke, and narrowing of arteries, atherosclerosis. If you have diabetes, you're more likely to have heart disease or stroke. Nerve damage from diabetes, diabetic neuropathy. Too much sugar can injure the walls of the tiny blood vessels, capillaries that nourish the nerves, especially in the legs. This can cause tingling, numbness, burning, or pain that usually begins at the tips of the toes or fingers and gradually spreads upward. Damage to the nerves related to digestion can cause problems with nausea, vomiting, diarrhea, or constipation. For men, it may lead to erectile dysfunction. Kidney damage from diabetes, diabetic nephropathy. The kidneys hold millions of tiny blood vessel clusters glomeruli that filter waste from blood. Diabetes can damage this delicate filtering system. Eye damage from diabetes, diabetic retinopathy. Diabetes can damage the blood vessels of the eye. This could lead to blindness. Foot damage. Nerve damage in the feet or poor blood flow to feet increases the risk of many foot complications. Skin and mouth conditions. Diabetes may lead to more prone skin problems, including bacterial and fungal infections. Hearing impairment. Hearing problems are more common in people with diabetes. Alzheimer's disease. Type 2 diabetes may increase the risk of dementia, such as Alzheimer's disease. Depression related to diabetes. Depression symptoms are common in people with type 1 and type 2 diabetes. Like, subscribe, share.